Dear colleagues, I'm Christoph Diener from the University of Duisburg-Essen in Germany, and my video this month tries to summarize the most important clinical studies which were published in 2022. I would like to start with a publication in the New England Journal in the first week of December on Alzheimer's disease. This study investigated a monoclonal antibody against beta-amyloid in people with mild cognitive impairment or incipient Alzheimer's disease, and this drug is lecanemab. And for the first time in history, a monoclonal antibody against beta-amyloid was effective, both for the primary and secondary endpoints, which covered cognitive function, but for me, most impressively, were the data on amyloid PET. Because in the placebo patients, the load of amyloid in the brain was unchanged, and in the treatment group with the monoclonal antibody, the amyloid concentration in the brain was decreased by 60 to 70% within 18 months. Now, how this would translate into clinical efficacy across many years, we don't know. So the most important message here is, for the first time in history, we have a drug that slows the progression of beginning Alzheimer's disease. There is also a caveat, and these are adverse events. These monoclonal antibodies can lead to brain edema, and therefore MR imaging is required every 3 months. And they can also lead to microbleeds, which are usually asymptomatic. But no one knows what will happen if these drugs are given long-term in patients who need anticoagulation because they have atrial fibrillation. Now let me move to post-COVID. We have now a large number of studies which looked at people who had COVID and looked at controls and monitored for somatic symptoms. And most of the somatic symptoms are, by the way, in the neurological domain. And these include, for example, headache, and they include fatigue, and they include dizziness, and back pain, and muscle pain, and nausea. And one of the studies in the Netherlands investigated this prior and after the COVID-19 infection and in controls. And about 20% of people who had COVID had still somatic symptoms 90 to 150 days after the infection, but only 9% of the controls. Unfortunately, we don't know what the pathophysiology of this post-COVID syndrome is, and until now we have no real effective therapy. Let me move to sleeping disorders. In the past, we used to have benzodiazepines, which were replaced by the SET substances. And the SET substances were supposed to not lead to addiction, but in some patients they can lead to addiction. Therefore, there is a need for new sleeping drugs. And the new class of drugs are the orexin antagonists. And daridorexant is a dual orexin antagonist and showed efficacy in 2 large phase 3 trials. And the good news here is this drug not only improves the latency until patients fell asleep, but it also has no hangover effect on the next day. The most debated aspect in multiple sclerosis was a large study from the Veterans Administration database, which showed that Epstein-Barr virus infection clearly increased the risk to develop multiple sclerosis. And for example, this is not the case for cytomegalovirus virus. Now, unfortunately, this is a very prevalent infection. 70 to 80% of adults have Epstein-Barr virus on board. And until now, we don't have a vaccine. And whether a vaccine would really decrease the likelihood of multiple sclerosis is still totally unknown. Now, let me move to Parkinson's disease. In the meantime, we know that alpha-synuclein aggregates in the brain are obviously a driving pathophysiological force in the disease. And a group in Kiel in Germany developed a blood test to identify alpha-synuclein in serum. That's the good news. The bad news is that we had 2 randomized placebo-controlled trials in incipient Parkinson's disease with monoclonal antibodies against alpha-synuclein, which were both negative. So at the moment, we do not have a treatment which has disease-modifying action in Parkinson's disease. Let me come to stroke. two important aspects. Several randomized studies which showed that adding thrombolysis to mechanical thrombectomy in the anterior circulation improves outcome and reduces mortality and increases the rate of reperfusion. But most importantly, we have now two randomized trials which clearly show that mechanical thrombectomy is superior to pure medical treatment in people with thrombosis or occlusion of the basilar artery, and this therapy improves functional outcome and reduces mortality. And finally, headache. The good news here is that the monoclonal antibodies against CGRP or the CGRP receptor are effective in chronic migraine. They work in people where prior treatments failed, and they also work in people with medication overuse headache, and they have almost no side effects. So beyond the high costs, this is really a step forward in the specific treatment of migraine in terms of migraine preventive therapy. Dear colleagues, 2022 was an exciting year. These are only a few highlights from 2022, and I thank you very much for listening and watching.